Well, good morning, ladies and gentlemen, and thank you for joining us today as we release the key findings from the Middle East Area of Operations Census and Prospective Health Studies. These studies are part of Defence's ongoing military health outcomes program to determine the impact of operational deployment on the health and well-being of our servicemen and women. When we released the findings from the initial mental health and well-being prevalence study in 2011, one of Australia's leading mental health experts, Professor Ian Hickey, described our work as a world-leading study. That was our first comprehensive look at the ADF's overall mental health. The findings we are releasing today build on that initial study and are now part of a significant body of research. These studies are critical to the ADF's ongoing commitment to provide first-class mental health treatment and support to our people. They are also a key element in our pledge to pursue continuous improvement in the field of mental health. Data is knowledge, and the analysis of detailed information contained in these reports does two things. First, it reinforces that our work to improve mental health and rehabilitation services is being directed to the right areas. Second, it gives us the ability to refine and target specific prevention mechanisms and to tailor our existing treatment programs to meet clearly defined needs. Rear Admiral Walker will go into more detail about the findings, but overall, the Census and the Prospective Health Study show that ADF personnel who have deployed on operations are generally healthy, both physically and mentally. I think at this point it is important to acknowledge that our Defence Force personnel are ordinary Australians who, as you've heard us say on many times, who are asked to deal with extraordinary events. We need to recognise that some form of anguish is a normal human reaction to abnormal events. That said, not everyone who is deployed will experience trauma. These studies show that most people will not develop mental health concerns, but we are better prepared today to help those who do, much more prepared than we have been during previous conflicts in our history. The term a tidal wave or a tsunami of PTSD has been used to predict our state as operations draw down to a reduced level in Afghanistan. This language is provocative and emotive and points to a simplistic view of military mental health. This view does not take into account that ADF personnel have been performing difficult border protection tasks and rotating in and out of operations in the Middle East for 12 years. Assuming a tidal wave, we should expect to be experiencing that now. Our data does not support this view. We have been helping people to deal with the mental health effects of operational service for a number of years, and we will continue to do so when the majority of the ADF personnel redeploy from Afghanistan later this year. We have made a significant investment in our resilience training, early intervention and treatment and rehabilitation programs to ensure that our people are prepared and supported throughout their career. We will continue to prepare ADF personnel for the challenges of operational service and support ADF personnel who are exposed to trauma at home or overseas. We have already improved screening for those most at risk, and we will continue to monitor and support ADF personnel who transition out of the Defence Force when many veterans need additional support. I would like to thank all the veterans who participated in this study. I would also like to thank the staff of the Centre for Military and Veterans Health for their dedication in producing this significant body of research. Ensuring the most effective preventative measures and best quality treatment and rehabilitation for our ADF personnel remains our highest priority. We know we must continually assess and reassess our policy and programs to guarantee we remain a world leader in this field. And we must continue our work to break down the stigma associated with mental health issues. I'd now like to invite Rear Admiral Walker to give you some more detail about the studies and its findings.
Thank you, sir. CDF, Mr Shane Carmody, Deputy President of the Department of Veterans Affairs, Associate Professor Peter Nasveld, Professor Annette Dobson, Mr Roger Glennie and Dr Carol Davey from the Centre for Military and Veterans Health, University of Queensland and University of Adelaide Snide, Mrs Julie Blackburn, Defence Families Australia, Defence and Service Representatives. The two MilHOP studies released today provide a comprehensive and robust account of the health of Australian Defence Force personnel and veterans who have deployed to the Middle East area of operations. The Census and Prospective Health Studies were funded by Defence and conducted by the Centre for Military and Veterans Health across two universities, the University of Queensland and the University of Adelaide. The Census Health Study details the current health of over 14,000 Middle East area of operation veterans deployed between 2001 and 2009. The study was voluntary and the response rates compare favourably with similar studies conducted by our allies overseas. The second study, the Prospective Health Study, was also voluntary and examined the pre- and post-deployment health status of ADF health personnel who deployed after June 2010 and who returned before June 2012. So we studied them before we left and then we studied them after they returned home. This allows us to identify factors related to the onset of health concerns post-deployment. A subset of these personnel, of the primarily combat personnel, also participated in physical tests and neurocognitive assessments, providing objective measures of health. The results suggest that the Middle East area of operations veterans are generally physically and mentally healthy. The most common health concerns on deployment were found to be respiratory, gastrointestinal and musculoskeletal injuries not related to combat. The area of greatest concern to Defence and to DVA is for the ADF personnel following deployment are mental health issues. We know that deployments can expose ADF members to traumatic events. The studies highlight that not all deployed personnel will be exposed to trauma, and most of those exposed will not go on to develop mental disorders. However, ADF members repeatedly exposed to traumatic experiences, either at home or on deployment, are more likely to develop mental health conditions. Specifically, the Prospective Study found that post-deployment, 4.8% of the participants reported symptoms consistent with psychological distress. 1.9% of the participants reported symptoms consistent with post-traumatic stress disorder. 2.5% of the participants reported symptoms consistent with an alcohol disorder. And 1.6% of the participants reported suicidal ideation. The Census study, the one that covered the 14,000 participants, confirmed that the prevalence of post-traumatic stress disorder symptoms was much higher amongst ex-serving members and those who'd been medically discharged, as you would expect. The prevalence of poor mental health was generally highest 2 to 3 years post the most recent deployment. Those who transition to the reserve or to civilian roles and have no relationship with the reserve were more likely to report mental health conditions than ADF members who remain in full-time service. There was little evidence of gender differences in the general health issues, although there was some evidence that women were more likely to report psychological distress and other mental health problems compared to their male counterparts. Defence and the Department of Veteran Affairs have a range of preventive, identification, treatment and support programs for individuals in these circumstances. And I can assure you that Defence will continue to provide risk-based interventions and screening to maximise support for those most at risk and not just on deployment. We remain committed to supporting personnel through early identification programs and appropriate access to mental health care services both during and following military service. The results reiterate what we have long recognised, that separation and military commitments do have an impact on ADF families, and a range of support options continue to be available to our ADF families. and we continue to seek opportunities for evolving our support systems. These independently reviewed studies, based on robust data collection methods, have provided a substantial resource from which Defence and the Department of Veteran Affairs will continue future research programs. Defence and DVA are currently in the process of establishing a strategic research framework to prioritise the further analysis of this rich data source. These studies will inform the way we plan healthcare services for ADF personnel and our veterans into the future. The findings reinforce the significant investment already made by Defence to improve mental health and rehabilitation services through the Mental Health Reform Program and implementation of the ADF Mental Health Strategy. As a result of these studies, Defence and DVA have identified programs that will benefit from review and expansion. For example, we are ready to embark on a review of our mental health screening to better capture exposure to potential traumas, regardless of where or when they occur. We are interested in the health of all our personnel, no matter the cause or the source. Today, we thank all the investigators from the University of Queensland and the University of Adelaide nodes of the Centre for Military and Veterans Health for these very significant contributions to the advancement of our knowledge and our understanding of veterans' health issues. I would particularly like to acknowledge the work of Professor Annette Dobson, the Middle East Area of Operations Health Study First Chief Investigator, and the Census Health Study Principal Investigator, and Dr. Carol Davey, Prospective Study Principal Investigator. Although he cannot be here with us today, I'd also like to acknowledge Professor Sandy McFarlane, who was the MEAO Health Study First Chief Investigator from 2007 to 2011. We are now better prepared than we have ever been, following previous wars and conflicts, to manage the health and mental health of operational services. I commend these studies to you, and here today there are copies of the executive summaries and the important findings of those studies, and the full studies with all the data will be available from the Defence website later following this launch.